Hi, very good evening all. On behalf of Astron E College, I Ms. Paulumi Banerjee welcome you all on board for the webinar session on IPSG goals. As you all are aware that Astron Institute of International Studies, Gurgaon is a NABIT accredited institute, and we have recently launched Astron E College under the umbrella of Astron Institute of International Studies. Astron E College is an online portal for working professionals, specially catering to healthcare professionals. The courses are pre-recorded video-based session of 2 hours. However, could be completed as per your convenient, that is within 15 days or 1 month. The courses are comprised of various modules and assignment. On completion of the course, you will get a globally recognized certificate, and the certificate is valid lifetime. For nursing professionals, we have courses like nursing quality management, nursing audit, infection prevention and control program, pediatric fundamentals, critical care support, clinical audits, and many more. Along with healthcare domain, we have courses in banking and finance sector, soft skill and motivational sector. For more details, you can log into www.astronecollege.com or you can call on 965004082 number. Now I take this opportunity to welcome Ms. Tejal Padhariya, who is our honored speaker for the session. She is nursing head of GCS Medical College and Research Center, Ahmedabad. Having more than 16 years of experience, she is seasoned professional in critical care nursing and patient safety, and she is an NABH assessor. Over to you, ma'am.
So good evening, all students. We just introduce International Patient Safety Goal. The world itself suggests that it is across the globe, people are thinking for the patient safety. So let's start with the introduction next. How it has been established. So the International Patient Safety Goal, IPSG, were developed in 2006 by the Joint Commission International, that's JCI, and the goals were adopted from the JACO National Safety Goal. Yes. Introduction. Next. Yes. The patient safety comes from the JCI basically, and they have developed and established the patient safety goal in 2006. From 2006 onwards, the compliance with IPSG has been monitored in all the JCI accredited hospitals from January 2006, and it recommended the target solution tool to help the hospital to meet the IPSG standard. So basically, we can just have a look on that history part. Established, and it was inaugurated by the JCI and JACO's goal. Next, if we see the how JCI has upgraded the over the time, it was firstly introduced in 2006. At that time, this goal were the little bit of having the conceptual, like reduce the risk of health acquired infection and reduce the risk of patient harm from the fall. So this type of minor changes has been done in 2011. And which was upgraded in 2017 to 21, that in 2021, we are working on the goal which are related to the as a whole. JCI has increased the vision and they have performed the 360-degree for the patient safety, and they have reduced, they have enhanced the goal for the patient safety, and the word itself changed, that reduce the risk of healthcare associated infection and reduce the risk of patient harm resulting from the fall. So you can just have a just have a glimpse that 2006 to 2021, how the JCI has changed the IPSG goal with the various data and with the various research. Now let's move on the part in detail how the IPSG we have to follow and implement in the practice. Next. So these are the 6 IPSG goal. First is identify patient correctly. Second is improve the effective communication. Third is improve the safety of high alert medication. 4 is ensure the safe surgery. 5th is reduce the risk of healthcare associated infection. And sixth one is a reduce the risk of patient harm resulting from the fall. So these are under six category. They have divided everything which is occurring or which may probable occur to the patient and which can result the harm to the patient. Let's go in detail with the goal number one. Next, goal one is a patient identification. When patient comes to the hospital, we have to just start the registration process. And in that, what are the details we are taking? From that, we have to identify the patient. Next. So what are the purpose of identifying the correct patient? It is to prevent the life-threatening errors, mainly the medication error, the identification error, or it may be in the interest of the maintenance of the patient's safety. So basically, identification of patient is very important. Otherwise, we can have the big error like a medication, किसका medicine किसको दे दिया, किसका blood sample लेके lab में भेज दिया without labeling. So first thing is a patient identification, and for that, all the hospital have their own norms and policies how to identify the patient. Most of the hospital go with the ID belt. That is a identification belt which is usually on the hand of the patient, and it is having the all registration detail. Some of the hospital believe that name and UHID, some says the name and MRN number, so it is almost a same or similar. Ultimately, we need to have identification of the patient by name, and second identification would be a unique ID or the medical record number. Next. So in this process, who can be a identifier? So already we have discussed what can be used, that is addressograph, ID belt, and patient's registration detail. Now who are involved? Next, department or people involved. So who, see, it is saying that patient safety start with me. ये nurse का काम है, ये doctor का काम है, ऐसा नहीं है. It start from the registration and admission department, and that is why the admission staff and registration staff, OPD counter staff, supposed to understand about the patient identification and having the correct detail inside. So throughout the stay of the hospital, patient will be identified with the unique name and unique identification number. So all the patients, care attendant like registration staff, nurses, doctor, paramedical, all are involved in this goal number one. Next, if anybody is not following this, then what can be the incidents? Wrong medication administration, wrong procedure to the patient, delay in the treatment, wrong diagnosis, overexposed to the radiation, taking sample from the wrong patient, and performing wrong investigation. As I told you or described again, I am emphasizing on that bed number 11 का ABG भेज दो, and patient 11 पे change हो गया. So ultimately, the wrong identification can lead to a treatment modalities as well. So we have to focus on goal number one, patient identification very well before any procedure, before any medication administration, or before sending a sample. Next. Next is a location of ID bed. I have just put this just for understanding, but it can be, having the different policy in the different hospital. But most probably the ID bed should be placed on the patient wrist on their dominant arm, and the nurse always find the ID bed and do the procedure accordingly. If in case of the injury, if it is a blood stain, if during surgery you have to cut that ID belt or remove the ID belt, the nurse is responsible to put a new ID belt and inform the next person where it has been supposed to be there. I mean, the hands are cut during the road traffic accident, there is amputation. So you have to put a ID belt at the leg side, at the ankle side as well, right? So it depends on the patient's condition, but the communication and handover has to be there. So ID belt must not be removed until the discharge process and authorization. Next. And at the time of physical discharge of the patient, remove the ID belt and discard it with all formalities, whatever the hospital policy has. Next. So ultimately, to sum up with the goal number 1, to identify patient correctly with each and every procedure. Goal number 2 is improve effective communication. As again, I'll give the same example like the bed number 11 ko fentanyl de do, bed number 12 ko ABG bhej do. So this is not the proper communication, especially communication in healthcare sector. In the course of the conversation, always focus what you are speaking, what you are enumerated, use a simple English. Next, use a simple English. You can have, if you don't understand the order, maybe the verbal order, you always ask for the second instruction. Don't do it by assumption. Because goal number 2 is again for the patient safety, and it says effective communication. Effective communication doesn't mean that hi-fi English, the proper good handwriting, or the proper speech, but ultimately the person has to understand what it means by. Next, basically in a nursing profession and the medical, the communication with the staff or doctor during the handover, that is a maximum communication which is affecting the patient care, right? And in that, the standard tool is a IS bar, which all the organizations are using. That is a identification, situation, background, assessment, and recommendation. In detail of IS bar itself is a one more session, right? You all know, being a nurse, what is meaning of IS bar. Ultimately, it has to be taken place at the patient's bedside. The picture itself showing you that the handover has to be at the bedside. Then and then only you can have the perfect idea of the patient's clinical condition as well as the hemodynamic condition, because you need to check the patients as well. You have to communicate for the patient, and that is why the handover has to be at the bedside. Apart from IS bar, what can be there for communication? The verbal order. The very important in goal 2, effective communication, you have to remember 2 things. One is a handover and second is a verbal order. Next, during the verbal order, doctor may ask you that give this injection, send this sample. So in that, always hospitals are using a readback policy. In that, whatever the telephonic order or verbal order doctors are giving, the nurse or the junior doctor is supposed to write on paper. He has to read back. Read back means he has to repeat that and confirm, and after that take a signature within a 24 hours. It is a policy most of the hospitals are following, that for the verbal order, the consultant or the person, authorized person, has to sign that particular order within a 24 hours, right? So in goal 2, we have to remember 2 particular things, that is a verbal policy, a verbal order, and second is the IS bar. One more, or in addition to that, I can say you cannot take a verbal order for narcotics. You cannot take a verbal order for the high alert unless and until the situation of code blue. Whenever the doctor is telling, immediately one nurse can be dictate and take a signature immediately, right? So you have to work according to the situation, but safety is always in a center part. Next is a goal 3. It is improve the safety of high alert medication. So in second goal only, I told you that the high alert medication or narcotics are very sensitive, and that is why you need to have the proper focus on that particular aspect. Now let's see what is meaning of high alert medication. Anybody will tell what is a high alert medication? High alert medication is a medication which is having the low therapeutic index or having the heightened risk of causing significant or catastrophic harm to the patient. Yani, if we explain you in a simple language, ऐसी जो भी medicine है जिसका therapeutic index, मतलब if हम थोड़ा सा भी इधर उधर dose देते हैं, then it can having the harm to the patient. So those type of high risk medications have to administer via double confirmation, right? So the medication use has become increasingly complex in recent time, and medication error is a major cause of preventable patient's harm. In a last session, whatever whosoever has attended, I already mentioned the data as well. What are the incidents of the medication error, and which can reflect in the death ratio of the globe as well. Apart from this, if the healthcare professional, you will have the important role in making the administration or medication use the safest way. High alert medications are drugs that bear a heightened risk of patient's significant harm, and that is why we have to have a policy of, first of all, procurement. Then second is the storage of high alert medication. The organization have their double lock and key, one lock and key. Policies is differ from hospital to hospital, but most of the time the high alert medications are with lock. Mainly whenever the nurse administer the medication, they have to medication. In that, the mainly 10 rights of the medication. Next. Yes, so this type of high alert medication checklist, which can help us to have a proper stock, proper uses, and proper replacement. Next. See, this is the lock and key drawer, right? So storage in a separate locker with lock and key. Yes, of course, it can be differ from the organization to organization, but most of the hospitals are using a single lock and key for the high alert medication, just to prevent the error and to have a proper stock of that. Most of the hospital having the list of the high alert medication, and the nurses are very well aware about the all adrenergic agonistic anesthetic medication, ACL, MGSO4, narcotics, chemotherapies. These all medications are high alert medication. So we have to double cross check or double verification. Next. So cross verification have two nurses double check high alert medication and two signature on MRA sheet, MAR sheet, that is medication administration. Wherever the administration of the high alert medication has been done, over there the one nurse who has administered, she's supposed to sign, and second signature is with the doctors or the second senior nurse. This is a policy of most of the hospital, but if there is a no policy, still you have to go for the double verification, specifically for the dose and for the before administration for the safety of the patient. Next. Apart from this, you can also have a develop the checking habit. Never administer a medication unless you are 100% sure or know what is it. Practice makes man perfect and permanent, and that is why start checking habit now. Always check it, and it will also become a habit. Never assume anything about a drug order, and that is why clarify, clarify, and clarify. Next. Sorry. So after administration of the medication, immediately document the drug. Never document before administration of the medication, and omit documentation can result in over or under medication. So ultimately, in high alert, you have to focus on the storage. You have to focus on the administration. Before administration, there has to be double verification. And after administration, document with the double signature. That's all. And this is all for the patient safety after so many research and having the multiple data which gather for the Joint Commission International How many patients death with the medication error, especially the medication which are the high alert. They have considered this a common policy across the globe. Next is a goal 4. Goal 4 says the ensure safe surgery. In that, the safe surgery starts before the surgery. What is there? The pre-operative care. So in pre-operative care, we have to check for the informed consent. Concern need to take from the patient's relative or patient's doctor, primary nurse are responsible for explaining the procedure and informed consent. Primary nurse cannot explain regarding the surgery. They can only explain regarding the procedure in front of the doctor or the resident who are taking care of the patient 24/7. The consent itself is a major topic, but we have to focus the pre-operative assessment as well as the pre-operative care of the patient for the safe surgery. And pre-operative phase, most important is the consent. Next is a surgical safety checklist, which everybody knows. It is a WHO surgical safety checklist, which is used for all the patients who are undergoing for the surgical intervention. Next. Next. So surgical safety checklist having a 3 component. One is a sign in, second is a timeout, and third is a sign out. Sign-in procedure has been usually performed before induction of the anesthesia. So before introducing anesthesia, the signing process has been done. In that, all the parameters which is regarding the patient safeties, the one nurse perform the duty, and second one will be having the documentation of that particular things, it has been done or not. So same way it is a timeout process, which is before the skin incision. So first is the before induction of anesthesia. Second timeout step is before skin incision. And third is a sign out, which means before patient leave the operation theater. So in this 3 phase, the whole surgical team perform this surgical safety checklist and check all the points for the patient safety to avoid the wrong surgery to the wrong patients. Next. Next is a goal 5. It is a reduce the risk of healthcare acquired infection. Again, whenever the healthcare acquired infection comes, it starts with the hand washing. So we should know when should you use the alcohol-based hand rub. If hands are not visibly soiled or contaminated with the blood or body fluid, you can use the alcohol-based hand rub for routine cleaning of your hand. Apart from that, before having the direct contact with the patient, before entering into the room or leaving the isolation room, before taking care of susceptible patient, before performing any invasive procedure, before cleaning the patient with the so ultimately, what is the use of hand washing with soap and water? What is a scrubbing? And when you can use an alcohol-based hand rub, that is very important to having the reduction of the infection. Next. Next. So now how to wash your hands. It is a very common and everybody knows the 7 step of hand washing. So it has a significant impact in reduction of the infection. So we all have to focus on the 7 step of hand washing and when to use the alcohol-based hand rub. So these are the 2 major part apart from all this autoclave, ETO, the instrument, this, that, root cause analysis, surgical site infection. Before going to all these things, being a nurse, we have to focus on the hand washing because it is a primary and single most measure which can reduce the infection. Next. So when to wash your hand. So this is also a standardized 5 movement of hand hygiene. It is a universal that before touching a patient, before clean and aseptic procedure, after touching a patient, after body and blood fluid exposure, and after touching the patient's surrounding. So these are the 5 major areas where you have to go for the hand wash to reduce the infection to the patient as well as from the patient. Nurse can also have the safety regarding the infection as far as the infection is a concern. Next. So ultimately, the standard precautions are the precautions to be used by all healthcare workers in all the situations involving the care of the patient or contact with the environment. So the standard precaution can be used for everybody, but we have to go for the hand washing for reducing the healthcare infections. Next. So you have to use standard precautions as well as hand hygiene, gloves, apron, gown, footwear, personal protective equipments wherever and whenever required according to the procedures. Next. So preventing occupational hazards, it is also require mask, eye protection, face shields for the patients as well as for the safety of the nurse. You can also include here the safe injection practice. That is a single syringe, single needle, single use. So you don't have to use a needle and syringe for the second time. You have to just use for one time and throw it out. Next. The last goal is goal number 6. It is a reduce the risk of patient harm resulting from the fall. Most of next. So in 2011, when the goal was revised from the JCI team, technical team or technical committee, they have the assessment of particular patients of the hospital, and they found that falls are not reported properly. Apart from that, if the reported, the injuries are not assessed properly, and the people have had the fear of having the fall in the hospital, and that is why they have changed the name, that is reduce the risk of patients harm resulting from the fall. That means fall can be expected. Fall can never be a zero. It is accepted like a medication error and all, but we have to have a reduce the trauma or harm which can be having a permanent loss or damage of the organ or having the disability to the patient. So that is what we just to have a motivation to have a proper reporting and proper assessment of the patients or client with the fall. So in all the organization, we do the fall risk assessment of indoor patients at the time of initial assessment. And for that, Morse fall risk assessment tool is a universally used. All the indoor patients are assessed once in a shift and whenever required in case of vulnerable. After fall, take care of the patient, inform the proper concern authority, fill the incidence form. These are all the formalities which all the hospitals are doing. Next. But mainly we have to see the proper assessment during the initial assessment. If we understand the risk, total Morse fall score is a higher side, then we have to focus more to prevent the fall. And for prevention of the fall, what you can do being a nurse, you can always have an education to the relative. Next. Then you can have the side rail always up, low height bed, continuous monitoring, safety rounds. There will be a changing, you can also have a change of the bed, and all the time vulnerable patients are in front of your eyes. Needy things near the reach of the patient, safety belt while on wheelchair or stretcher, patient relative education always, especially for washroom, and whenever patient go for washroom break, that time you have to attend. That kind of patient's relative education is also important to prevent the fall. Ensure for dry floor or signage is board while cleaning in process. And night light must be used and on during the night shift by the nurses. So these are the preventive strategy which can be having the for the patient safety and especially to prevent the fall. Next. So let's bring together our patient safety and quality of care. In nutshell, IPSG is a clinical area which would reduce the number of issues like the staff. It would help them to minimize the risk of error and for the patient to decrease their burden of healthcare associated risk as well as acquiring the quality of care. So IPSG is generally useful for patient, for the nurses, for the healthcare worker, and for the organization. Ultimately, safety is a always priority. Next. Thank you so much for your patience. Now, any question, any doubt, you can always discuss, or you can have the my official email address. You can write it down, and you can also have the question on that email. I will definitely revert within a 24 hours. My official email address is tejal.padhariya@gcsmc.org.
Thank you so much, ma'am. Thank you so much.
Thank you, Palmi and Astro Institute.